So I was asked to talk today about future therapies in MS and focus on the topic of stem cell, potential use of stem cells as a therapy in MS. And I would like to use my time to discuss both what are stem cells and then what are the challenges of using them in multiple sclerosis. And I heard Peter Rickman's comments earlier today, and I think one builds on what Peter had to say, whereas we go forward in trying to deal with the problem of restoration in multiple sclerosis, we need to understand, first of all, what is being injured so we know what the targets are that we're addressing. My slides don't have the wonderful three-dimensional components of Peter, but I will borrow Peter's slides for next time. So that in multiple sclerosis, in the nervous system, we have the nerve cells here, the neuron, and its process, which is called the axon, and around it is the myelin, the insulation, and for effective electrical conduction, for signals to get through the nervous system, you need to have this myelin so that the conduction goes from one part to the next in an efficient way rather than dispersing and the electrical signal being lost. So we have to think about in multiple sclerosis that we have an interruption of the myelin here, and this is actually a picture from a distinguished neuropathologist, Bruce Trapp, that shows you here the red is the myelin. This is an actual specimen of an MS tissue section. Here's the myelin. Here is a nerve fiber remaining where there's no myelin there. Here is a cell that's potentially capable of making new myelin, but it is making contact here, you can see, but it is not causing the myelin to repair over here. The other issue that we have to consider is that we not only have to restore the myelin, what happens if the nerve fiber itself is lost? Now, if we turn to multiple sclerosis, and you saw a slide similar to this from others, this is the typical course of multiple sclerosis where the person has initial relapses and recovery. Over time, a certain proportion of people no longer get the recovery and have an accumulating deficit, which one refers to as the progressive phase of disease. And I think it's important to several aspects from this slide. First of all, if we're going to understand the disease and develop therapies, we have to understand what causes the initial event. And then, which we've paid relatively little attention to, is why do you ever recover from a relapse? And can we take advantage of understanding that to promote whatever processes underlie the spontaneous relapse? And then to consider this progressive component. Is that because there is continued injury of the nervous system, and is there a failure of the repair mechanisms? And this will be a theme, and Peter Rickman talked about this as well, is we're going to have to both prevent further injury as well as promoting recovery. Now, this slide also is an important one. This was generated by the group at London, Ontario a number of years ago before treatments came, so we could understand the natural history of MS. And what the importance of this slide is that this green bar shows these were people who had very few attacks in their early phases of the disease, and indicates that fewer of them became disabled than people who had many attacks early on in the disease course. And one of the things that we're hopeful is that in the last decade or two, with the early diagnosis of the disease, largely because of the advent of the MRI and the increasing introduction of therapies that Peter Rickman referred to, that if we can reduce the early injury, will we, in fact, prevent the later progressive phase of the disease? Now, clearly, we're going to have to deal with people who have the progressive phase, but there still is the hope that the aggressive early therapy, hopefully we can reduce the extent of the progressive component that is coming later. Now, if we think about why do you recover from an attack of MS, I've made a list of several possibilities. One is that when you have inflammation in the nervous system, that inflammation, just as if you had inflammation elsewhere, eventually the inflammation resolves. The chemicals that the inflammatory response is making decrease, and there is a reversibility just simply from removing the inflammatory process. The second is that the nerve fibers themselves may have capacity to recover function even if we reduce the myelin, and we're not going to talk about that in any detail today. And the other, which we're also learning, is that the brain has a plasticity so that the brain can, if one part is injured, perhaps another part can take over. And the focus of my talk today will be related to repair and regeneration of the myelin. So I put this slide in just to emphasize the other component, and that is this was actually a patient with MS on these two figures. This is called a functional MRI. This was actually done by my colleague Doug Arnold together with Paul Matthews now more than 10 years ago. That if you ask someone to tap a simple act like that, just tap the finger together, you can tell by this technique that this is the part of the brain that's being used. This is a patient who was initially paralyzed in the right side and recovered just enough function that she could tap her finger. And to do the same tapping as the normal individual, you can see the different parts of the brain that become activated. And gradually, as she recovered, it became less use of these additional areas. And I think there's an important area, and that people who deal with rehabilitation are taking advantage of these techniques where we now can start to objectively measure what kind of responses we're getting. And so there is a plasticity of the adult human brain that we never really appreciated in the past, and how to take advantage of that. Now, this slide I put in because if we're going to talk about remyelination and regeneration, is there any evidence that that actually occurs? So let me give you two examples. Again, this is from my colleagues Jacqueline Chen and Doug Arnold in Montreal. And what they've been doing is they have looking at people who have MS, and they're doing MRIs in a serial fashion every few months. And they have a technique, which it happens to be called magnetization transfer imaging. Alan, if you want to repeat that. Okay. That MTR here, that what this does is a technique to measure the integrity of myelin. If myelin is being lost, it'll show up in red by comparing one scan to the other. And if there's increasing myelin, the computer generates this as a green signal. And you can see that in a lesion of MS, that in fact there are areas where by MRI criteria, there seems to be ongoing remyelination. And this panel here, which is actually a study of MS tissue done by Monica Albert and the group in Göttingen that we were fortunate to participate in. These are MS lesions, and I just want you to look where the green pointer is. This very pale area is an area of demyelination. And then this tissue is stained with an antibody that will tell us whether myelin is coming back or not. And the pathologist can judge that. You can see in this area there's no brown staining. Here there's a little bit of brown. Here there's a little bit more. And here there's quite a bit of brown staining. Same thing here, little, none to considerable. And that is evidence that there has been actual remyelination occurring. Well, if we see remyelination by MRI and we see remyelination by actual looking at tissues, then the question comes, where is this remyelination? What cells are allowing this remyelination to occur?